Right. Good afternoon, everybody. Just wanted to give you an update on where we are in the last 24 hours. I'm here with Josh and Paul. I think if you look at this chart, two numbers strike me. One, the number of hospitalizations, new hospitalizations. That's a net increase of 20. That's a low number. That shows, that's good news. Shows again that maybe, just maybe, our social distancing is working, lowering the infection rate, lowering the hospitalization rate. But stop the good news right there. It's a milestone, tragic day. We have over 1,000 of our citizens, members of the Connecticut family, who have now passed away. That's 1,036. Take a moment to just say a prayer for their families. I just want to make a reminder. We spent yesterday talking about reopen Connecticut and what we're going to do to get this state going again in a safe way. We're focusing on that every day, and we'll report back to you on a weekly basis exactly what that strategy is. But I wanted to show you this chart. I was struck by it. I saw this somewhere. You can see measured by weeks and measured by deaths per thousand, what different impacts are. You can see car crashes at the bottom of that chart, sort of fascinating. You know, you always hear about the number of car crashes. And by the way, car crashes aren't contagious. You see some of the other flus we've heard about, the Asian flu, the 2018 flu, see how they're reflected. And then you see how unique COVID-19 is in terms of its infection rate, and this measures death per millions. In 5 short weeks, it's surpassed cancer and heart disease. So while we celebrate fewer hospitalizations and the fact that we maybe have a chance to slowly get back on normal, don't take your eye off the ball and what a risk this is. And I'll say is just one other thing. I was sort of interested in the numbers I saw today, because we know that it's in the more urban and congested areas that the virus has struck hardest, starting with New York City, and now Bridgeport and Hartford. But it's worth remembering it's growing fastest in our rural states. It's growing fastest in Oklahoma, Nebraska, South Dakota. South Dakota is up over 200% in the last week alone. And those are states that never put in place stay-at-home orders. So again, I just want to remind you the importance of what you're doing and the sacrifices you're making in terms of social distancing. The next chart is one you've seen before. Again, you can see Fairfield and New Haven and Hartford. Again, it's not going up geometrically, maybe flattening out a little bit in those places. Numbers we're watching to give us hope. And the next chart sort of gives you a different way of thinking about the day-to-day change in hospital admissions now. I think of admissions as the best leading indicator, because the net number reflects discharges as well. And if you look at that, you see it goes up and down. There's no reason for a lot of false confidence, but you can say going back from April 1 to April 15, the average day-to-day change in admissions went from about 120 on that particular day down to about 60 on average now, the 3-day moving average. So there is good news there that's worth reflecting on. I just want to say, well, I just might as well make a mention of this as well. We are ramping up the testing. We're doing the testing on a more broad-based basis. So the CVS test, you know, we reached out to the CEO, Larry Merlo of CVS, what was it, 10 days ago, Paul? 10 days ago, and 10 days later, this site is up. It's a drive-through test. You go online, cvs.org, you put in your symptoms, you'll get a ticket that says your symptoms reflect the fact that you ought to have some sort of a test. Open 7 days a week, 700 tests per day, free to everyone. CVS.com, I say. So this shows you that we're ramping it up, making it available to more people faster. And by the way, our first responders get the first 100 tests every day. First responders, 4 tested positive today. I want to just say one thing about the stress we're feeling as we go into the second month of this pandemic. Obviously, it's just a fear of the disease itself. You can see by those numbers, those COVID numbers. If you're a senior who's isolated, can't have meals with anybody. It's the sense of isolation as well as just the fear of what the virus could be. And just know that we are getting through this, and the number of people who survive are overwhelming if you don't go to the hospital, and still strong if you have to go to the hospital. But boy, if you're over the age of 65 or so, the best thing to do is stay socially isolated so you don't get. Also, food insecurity. Our 211 United Way calls just reflect the anxiety people have about something as basic as food. I was struck reading the Danbury Times today, and they talked about all the folks driving in to the food bank to get their food, and then at a certain point they stopped delivering the food any longer, and the sense of fear that represented. I want you to know a couple things. One, our food supply in this state, in this country, and our food banks is strong. Maybe we're not getting quite as much voluntarily donated anymore, given the nature of restaurants and the such, but people are still providing the resources we need to buy it. Obviously, the Dalios gave $1 million a couple of weeks ago. 4CT.org, our amazing philanthropic effort, they donated $1 million just yesterday, and you're going to see a drive-through food share at Rentschler Field on a Monday from 8:30 to 1 o'clock, Monday during the day. There's food for you there. There's food for you at the grocery stores. I was struck by just the small acts of kindness. At Travelers, which is the insurance, which is virtually closed down thanks to telecommuting. And that meant the cafeteria workers there thought they were about to be laid off. And instead, Travelers said, no, we're going to hire you and pay you your salary and benefits, and we're going to use this cafeteria to feed others. And they've been distributing hundreds of meals every day to Hands in Hartford, Meals on Wheels, other ways that people are showing small acts of kindness that hopefully give you a sense of hope. Look, volunteerct.org, volunteerct.org. We've had hundreds of volunteers come forward there. Hundreds have gone to the food banks and food share, helping out with the distribution of food, making sure that somebody who's got to stay at home, quarantined, still can get a meal delivered. And that's what we're doing. United Way just made an agreement with Grubhub, again, for the delivery of food. We got to stay serious in terms of maintaining our discipline for at least another month. And these are amazing groups. They're helping to deal with that, deal with food insecurity, and hopefully reduce the stress you may be feeling. There's obviously the financial distress and a little anxiety for the small business. I know that the Paycheck Protection, they've run out of funds, or they've delivered resources right now. I think something like $4 billion went to the state of Connecticut, so we're making a difference there. Thousands of folks did get their loans, and that will be topped up again in the very near future. But what I really wanted to do was ask two people who are really on the front lines of just the personal sense of distress and anguish that we hear every day. We hear it on our 211 calls. Our teachers hear it as they do telelearning, and they're on the phone with students, but they're also finding a lot of students, if they're absent, we're calling in, finding them the telecounseling necessary to keep those young people energized, not to mention their parents. And these two people I'd love to have talk just for a few minutes. First is Miriam Delphin-Rittman. She is in charge of mental health and addiction here for the state of Connecticut, on the front lines, doing everything she can to provide support for families. And after that, we're going to ask Vanessa Durante, is our amazing leader of Department of Children and Families. Just tell us a little bit about what they're hearing, the anguish of some of the families that they're reaching out with, and how we're trying to respond. We can do the PSA, or Miriam, what do you propose?
Yes, thank you, Governor.
Hey, Miriam.
Hi, good afternoon. Thank you for having me on. Yes, you mentioned, I heard it from our partners, and we serve about just the stress of this. For many people.
Hey, Max, is there there's an echo there, isn't there?
We have an echo?
Coming through clear.
Okay. Yes. So, I mean, what we're hearing is for many people, the social isolation is challenging. That for them, being disconnected from folks can sometimes bring up feelings of anxiety or stress, and for some people, can help them to or contribute to their reliving past traumas and past anxieties. I'm also hearing from some of our community providers that there may be some individuals that are turning to alcohol as a strategy for coping. And so that is something is emerging as a challenge area. We're also hearing that people are reporting trouble sleeping in some instances, or overeating as a function of being home and being disconnected from people. We're hearing also that there's a lot of worry about just, one's own health. Whether the virus is going to impact people individually, or whether it's going to impact family members that they love or some of their friends. And so just a lot of anxiety and worry about sort of what this means for people, what it means for their communities, what it means for family members. And so one of the things we've been working on at DEMIS is putting together a DEMIS COVID-19 webpage. It's a one-stop shop for a range of resources to help people with healthy coping skills. There are links to different websites about coping and about strategies for managing stress. There are also a number of resources connected to supports that are available within the area. So, for example, there are telephone support lines for young adults. So a support line that's for young adults and run by young adults. And it provides support for people to be able to connect and just share some of their feelings and share what they're experiencing. There are also support lines for family members and people in recovery as well. And all of that is listed on the webpage. We also have links to organizations that are providing online virtual groups. And we know that's important because people are talking about feeling isolated and feeling disconnected from folks. So being able to participate in an online group to be able to share one's feelings is something that's valuable. NAMI Connecticut is offering some of those, as well as Advocacy Unlimited, another group that we fund. There are also support groups that are being offered by CCAR. So that's the Connecticut Community for Addiction Recovery. These are online support groups that are done virtually by people in recovery for people in recovery. And so those are also available. There are other supports that are available as well that are listed on the webpage. We know that people are still struggling with opioids. So we have a number of resources associated with how people can get connected to medication-assisted treatment, or how a person can reach out and receive an assessment about where they are in terms of their substance use, and potentially be linked with detox if necessary. And we will still come out and give people a ride to detox if necessary. So if somebody calls our access line, and again, they can get connected to the access line either through 211 or access phone number itself, which is 1-800-563-4086. And again, that's a line where a person can receive an online assessment and then essentially be connected with an appropriate level of services. So again, a number of resources around here. I encourage feeling alone, or if they're feeling stressed out, because certainly what we're going through right now is unprecedented. We have never experienced anything like this as a state or as a country. So the uncertainty associated with it, what many of our providers are telling us, or what I've heard directly, is that people are feeling the stress, and it's beginning to handle. So I encourage folks, if you're struggling, reach out, get support. It's important that we socially isolate, but if you're feeling stress, it's important not to carry that stress or not to feel it alone, because know that there are others that are there that can be a support and that you can connect with. Again, so the DEMIS COVID-19 webpage, you can access that by just Googling DEMIS COVID-19. And again, there are a range of different services and supports that are available. I heard about one recently that's available, and it's online yoga. So you can participate in a virtual yoga class, and that sounds pretty exciting. I'm actually going to try that one myself because I did yoga once, and it is quite a workout. So I'm looking forward to trying that one. But again, you can participate in virtual yoga classes, virtual meditation classes, discussion groups, and so these are certainly just opportunities to connect while we're in this sort of phase of staying home to be able to stay safe. So those are just some of the resources we have available. I do want to give a quick shout out to the DEMAS employees. I have a number of employees that are working in our inpatient units and across the state, and they are true healthcare heroes. I appreciate their work, and I just want to thank them while I'm here and while I have the floor. So thank you to all the DEMAS employees that are out there working with the people we serve with such dedication and commitment and compassion. So I'll stop there. I'm happy to answer any questions when we get to that point. But again, I encourage people to check out the DEMAS COVID-19 webpage, and there are a range of services and supports that are available for you if you need those. So thank you.
Thank you, Miriam. Vanessa, are you there?
Please unmute.
You have to unmute, I think.
That's been the story of my life, working through this virtual world. So hello, Governor, how are you? All families need help at times, and this is a particularly difficult time for us all. As Commissioner Delvin-Rittman talked about, reaching out for help at this time is also a sign of strength. And we at DCF are pleased to work with our partners at United Way 211 and many local private providers in collaboration for what we're calling When It Builds Up, Talk It Out. And so, we know at DCF that families are the single greatest strength of support for their children, and communities are the greatest source of strength for our families. And we believe in community. And so with that, we've tapped our community private providers to help us during this crisis, and it's been immediately embraced. So when we begin to think about using our providers, we think about how we can connect with very talented and dedicated resources who support families and support treatment of families and their children. So the department already contracts with many of these providers, and we invite any parent or caregiver to talk it out. What you're going to hear in a few minutes is an opportunity for us to be able to use trained professionals when families need support, understanding, or a referral to specialized services such as clinical treatment, domestic violence counseling, or just help with food, housing, financial assistance, and the connections that many of us need during this crisis. Reaching out for support is healthy, it's normal, and it can make you an even better and stronger parent. So we're launching a public service campaign using donated advertising time from Connecticut's TV and radio stations to help us get the word out. We're soliciting parents and caregivers who could benefit from just talking to a professional who can understand, and invited to call. We'll show the PSA in a minute, but the call line is 833-258-5011, or simply talkitoutct.com.
Right now, it can feel impossible to be a parent or caregiver. With everything going on, the pressure just builds up, and it can be so hard to keep it in. But if it ever gets to be too much to take a step back and take out your phone. Call the Talk It Out line. We're here to listen, to understand, and to talk your feelings out. When it builds up, talk it out.
Oh, that's marvelous, Vanessa. Thank you for that.
It's an opportunity for us to recognize the humanity of us all. This crisis has brought about stressors, but we know that Connecticut is strong. We know that families are strong, and we know that we'll be resilient on the other side. But during this crisis, sometimes you just need to talk it out.
Talk it out. Thank you. Max, any questions?
We'll start with Fox 61.
Zinnia Maldonado, Fox 61. we had a viewer reach out to us with concern about marinas in Connecticut last week, and then Governor Cuomo said that Connecticut called him about this today regarding New Yorkers traveling to Connecticut for marina use. Could you comment on that, but also the dangers of people traveling between borders still at this time?
Yeah, I heard most of that. Yeah, what Governor Cuomo and all the regional governors have talked about is when it comes to opening up different facilities, to do some of them on a simultaneous basis, a bar, a restaurant, a marina, even a beach. Down in Greenwich, they had to close Todd's Point Beach because a lot of people from New York were going up to that beach. If he if he keeps his bars closed and we opened ours, you'd have people going back and forth. So I think, we're going to make up our own mind in terms of how we open up Connecticut over the course of the next, 6 months. We are coordinating some of these things just to do everything we can to not give anybody an incentive to have to drive across borders or to drive from the southern part of the state to the northern part of the state.
And then also, you mentioned earlier this week about an executive order in terms of face masks within 48 hours. What's the latest on that? And then could you also just talk about how you're doing? I believe, Vanessa just talked about mental health and for families, but you, Governor, it's been a couple of weeks now that you're dealing with this. Talk about how you're doing.
Well, I prefer to talk about masks, and we are getting an executive order there. It's really guided by common sense. If you're an employer, provide your employee a mask, especially if you're in a grocery store or a place where you're public facing. And if you can't get a surgical mask, and we're getting more and more of those every day into the state, then provide a scarf or a bandana. If you're walking around and you're in a crowded area and you can't keep that 6 feet of distance, then you should must put on a mask to protect yourself if you can't keep the necessary social distancing. I think I showed you what's going on in areas where we've maintained strict social distancing and some states where they were a little more casual about it. I don't want that to happen here in Connecticut. Look, speaking personally, I'm doing great. I don't know, some of the TV guys say you look tired on TV. I feel wonderful. I feel proud that I have an opportunity working with amazing people like Miriam and Vanessa, making a difference in people's lives every day. And that's why I wanted to be governor, to help make a difference at a time where government can make a difference in people's lives. But thank you for asking.
We'll move on to WTIC 1080 News Radio.
Good afternoon, Mr. Governor, and I think I see Josh sitting there as well. The mass testing that it will take to allow for easing some of the restrictions, that's a daunting task. How do you see that playing out, and how long could it take to get the antibody tests to be able to prove that various arenas and openings are safe?
I was on the phone with the CEO of Stanford Hospital. They're going to be ramping up hundreds of antibody tests on a daily basis pretty soon. I think you can see that extend around the rest of the state. I mentioned the CVS testing that's launching in New Haven today. That's going to be 1,000 tests a day. We're working with other Connecticut companies with a variety of other testing mechanisms, including a saliva test that would be just transformative in terms of people being able to self-test at home. So I think all that testing is going to ramp up in a way that gives us the data, the information we need to tell you when it's safe to start up your business, when it's safe to go back to school, and how we phase that in over a period of time. We're going to have a decision note on May 20th. We talked about that yesterday because we stipulated earlier that no schools are going to open up before May 20th and probably no stores as well. But we're reaching a point where we'll be able to start making some decisions, and that will be a decision node.
Josh, you think we'll reach that level? Dr. Koch called it mass testing. Will we have that level within, a month or so?
Well, we're certainly working very hard on it. The advisory group has a lot of great connections, and we're working with the major commercial labs in discussions. We're focused very much on the labs here in Connecticut. We have a number of CLIA certified labs here in Connecticut who have raised their hand and say they want to participate in helping us scale up our testing considerably. The examples the governor just gave of things that are already happening, I think you'll see more and more of those every week.
Thanks.
Move on next to the Connecticut Mirror.
Governor, or really Josh or Paul, is the state able to track COVID infections among state employees? And are you able to do any analysis as to who are the folks most at risk, whether it's Connecticut transit drivers, DOC employees, or whatnot?
Yeah, we get daily reports from each of our commissioners about our employees and infections in our various agencies. We do take actions across the agencies. Commissioner Delphin Rittman, for example, Commissioner Durantes have both dealt with a number of cases in their respective agencies, and they're working with our Department of Public Health team to take all the appropriate precautions, make sure we have the right PPE out on the front lines. This is a daily discussion that's going on.
And I will also add that as we get further down this crisis, the numbers that you're also seeing, not only from the state employees that we are putting out in our various agencies of those who have been afflicted with COVID-19, you also are seeing the numbers of those who have returned back to the workforce, who have recovered from COVID-19 as well. So we'll be continuing to provide those numbers in our various agencies throughout this crisis.
Do you have those numbers handy? And if not, can you bring them out perhaps at the next briefing?
Yeah, we can provide that information.
Correct.
All right, thank you.
Move along next to the day. The Day of New London. We will get back to the day.
Am I off there now? Can you hear me now?
Gotcha.
Hi. Governor, I wanted to ask about these, the rapid testing sites. Do you know where and when more of them might be located? And I want to make sure I understand how it works correctly. Does the patient actually know their results of the test before they leave the site?
I'll start and then hand that over to Paul. But the Abbott lab test, it's 5 minutes, 15 minutes, so you know immediately. You go to the CVS site, as we explained before, cvs.org. They'll tell you whether you fill out an immediate online form, whether you have the symptoms that justify you being tested. And while New Haven is our first site, Paul can tell you about other plans going forward.
Yeah, as you probably know, the governor reached out to the head of Abbott Labs, and we were able to be one of the first states to actually receive an Abbott machine, which was at Stanford Hospital. And then we eventually received additional Abbott lab machines through the Department of Public Health, which has been distributed to our various hospitals across the state. This partnership with CVS is one of 4 in the nation that came about when the governor had a conversation directly with the CEO of CVS. And all of our teams, including the City of New Haven, Mayor Justin Elliker, Senate Leader Martin Looney, Representative Tony Walker, and the whole New Haven community really got together, in addition with our National Guard, Department of Public Health, Department of Emergency Management and Public Protection, to really bring this site to fruition. So we are hopeful that we'll see if we can get additional sites of this type throughout the state, but we're very optimistic about what this site will actually do and be really a standard bearer, not only for this region, but also for the nation.
Thank you.
Move along next to NBC Connecticut.
Governor, can you clarify about the marinas? Will you be closing them or doing something to prevent New Yorkers from coming over to the state and putting their boats in the water?
Whatever we do with marinas, it'll probably be in conjunction with our neighboring states at the same time.
But that has not been decided yet.
That has not been decided yet.
Okay, can you explain, a couple of viewers actually have asked us why the lottery is considered essential?
I'll start. I mean, right now, the lottery is up and operating. I guess you get it at the convenience stores, and you're already going there for something else. So we decided not to discontinue it at this point, but that's something we're looking at all the time.
Okay, and my last question is, why hasn't the state suspended the practice of charging a bottle deposit
while redemption centers are closed and stores are not accepting recycling?
Right. How come you haven't done that, Paul?
Thanks, Governor. I know the original mindset of various redemption sites was about the health element. The Department of Environmental and Energy and Environmental Protection put out guidance to those redemption centers as well as stores as it deals with if they decide to accept bottles, what are the safety protocols, and also gave them the option to not accept. And that was one of the very earlier executive orders put forth by the governor. So we did take action on that, providing the option to redemption centers as well as stores on accepting the bottles during this COVID crisis.
So you're basically saying it was optional whether or not to accept them, so therefore the redemption, the charge continues, I should say.
Correct.
Thank you.
Move on next to CT and Vivo. CT and Vivo. Move along next to Connecticut Public Media.
Thank you. Governor, on the issue of unemployment claims, you had mentioned on Wednesday concerns about the state's unemployment fund getting totally drained by this massive spike in jobless claims. So I wanted to ask, how close is that to happening? And if it does, will the burden fall on Connecticut employers and workers in the future to replenish this fund?
Yeah, that's a very good question. You know, the good news is we put about $200 million in additional funding into the unemployment fund over the last year and a half. So we had a relatively good balance, but no balance is enough to deal with the nature of the unemployment claims that we're seeing right now. So we're negotiating right now via our great congressional delegation to see how the feds are going to respond. They either lend us money at a very, very low interest rate, but unfortunately you do have to pay that back, or they'll make that available as a grant, which obviously small businesses and states would love them to do it that way. That would not impact anybody's rating and keep us whole.
And has that come up in your conversations with President Trump at all?
Not that specifically, no.
Thanks.
Move on next to the Waterbury Republican American.
Thanks, Max. Governor, I was looking at the report today. African Americans, the deaths per 100,000, I believe the 427th, the highest out of any racial or ethnic group. The deaths are 40, again, the highest number. How concerning is that to you, and what are you doing about it?
It's scary as hell. Obviously, some people live in denser areas. Some people can't social distance within their home. Some people have pre-existing conditions, be it asthma or diabetes, and that seems to hit the African American community most severely. That's one of the reasons, as Paul said, that we wanted to do testing in a place like New Haven with a great diversity to make sure that nobody goes without the testing. At least we can get you the aid you need sooner.
And I'll also add, this crisis has really shown, not only in our region, but across the country, what social determinants of health really means. And so when you really look at it at the core, the governor is absolutely correct. When, in terms of putting a center like this, the CVS Center, in a city, New Haven was one that was top of mind. And the additional aspect is, when you look at how a person gets tested, it's usually making sure that they have a primary care provider, that they have a doctor to be able to get a doctor's note. The beauty of this CVS partnership is that an individual can go online to cvs.com, click for Connecticut, and answer a few CDC specific questions, and that will be their doctor's note. They don't have to have a PCP. There's going to be a lot of work that we're going to do outside of this crisis to really start addressing at the very core the social determinants of health within our state. And that's the great, and I know our Commissioner Durantis is shaking her head because this is something that her and I talk about on a daily basis, along with Commissioner Delphine Brittman, and I can go down the line of all of our other agencies. But yes, it is concerning, and I'm speaking as an African-American male who was born in Hartford. it's something that is top of mind of the governor and is top of mind of this administration, and we're going to continue to work on it. And I look forward for us to roll out more additional testing opportunities within our urban areas so we can address it at the very core.
Okay, thanks. The governor, the state NAACP has requested a meeting, a top-level meeting with yourself and your cabinet officials. I believe there was a letter to yesterday or the day before. Anything to report on that request?
I don't know about the request, but I'm happy to meet with Scott anytime. I'll give him a call. Thank you.
Yep, and I've also been meeting with Scott Esdell and the head of the NAACP before a letter came through, talking about the very issues that I just talked about in my previous answer, as well as the main reason why we wanted to make sure that the testing numbers on African Americans, Hispanics, and other minority populations are posted came out of a direct conversation that we already had as well.
Okay, well, thanks very much, and you guys hang in there.
Thanks. Channel 3 Eyewitness News.
Yes, Governor, I'd like to talk about nursing homes really briefly. You know, the dedicated coronavirus homes took more than a week to get off the ground, and based on the numbers that we got yesterday, it seems like precious days may have been lost there. So what were some of the obstacles in getting these homes up and running, and where do we stand right now?
Yeah, I'll hand that over to Josh, but look, we were very early on, I think, the nursing homes, one of the very first to say no visitors there. That took some heat, but it slowed down at least the spread a little bit there. Josh has been on the front lines trying to negotiate getting access to these additional facilities so that we can open them up. You know, but it's tragic. The nursing homes have been a home of the pandemic in, you know, virtually every state out there. We have about 40% of our fatalities are related to nursing homes. In Massachusetts, it's about 50%. So this is something that's not unique to Connecticut by any means. We've done okay. We got to do a heck of a lot better, and Josh is going to do that.
Yeah, I mean, I definitely would give a shout out in particular to our public health team, our DSS team, who've been working very diligently with the nursing home operators to get these up and running. To be very direct about your question, there was some significant change in CDC guidelines in the middle of that week that you described that caused the team to have to change course, recognizing the contagious nature of COVID-19 before it becomes symptomatic. It put a significant change in the plan. So there were some adjustments made, but the teams reacted quickly. Also, another challenge the nursing homes has faced is for these new alternate sites. Some of them are being reopened from scratch, so they have to be staffed up. And our OPM Secretary, Melissa McCaw, and our DSS Commissioner, Deidre Gifford, have announced today with the governor's direction to increase the financial supports as well to nursing homes, most of the nursing homes that have COVID patients, increasing the rate for COVID positive patients to $400, also increasing the across the board rate increase from 10% to 15% for 3 months here to help cover some of those additional costs they're facing around staffing and PPE that'll help accelerate that momentum as well. But as I said yesterday, we do have our first COVID alternate site open. It's now accepted its first couple patients. It has 70 to 80 referrals already in place from hospitals looking to discharge patients. So it's showing the demand and the importance of that, and we're going to be opening up additional alternate sites through the weekend.
Got it. Just kind of wanted to, hone in on some of those obstacles, though. The obstacles came from the CDC or on the CDC level?
I wouldn't call it an obstacle. It's just, as the governor said many times, this is a very dynamic crisis, and so as we learn new information, we have to adjust and react to that. And so when the CDC issues new guidance, we have to factor that into the plan and determine if the plan needs to change as a result, and that's really what happened here.
Move on next to CT and Vivo.
Good afternoon, Governor Lamont and all to your team. My question is, have you considered any kind of financial relief for undocumented residents in the state? Governor Gavin from California has announced this week that they will provide $500 per person and $1,000 for a family. So do you think Connecticut would explore an option like this?
I can start. I can tell you that for all of our citizens, including undocumented There's no cost for the tests. There's no cost for treatment. We're working with the federal government to do that. In the meantime, the state is taking care of that. I want everybody covered, anybody who feels at risk, anybody who shows those symptoms, to get them treated. I don't want anybody walking around the community unprotected.
In addition to your question, the governor and his team has already had conversations with various members of the legislature, including Senator Julie Kushner, about the undocumented community. So we are going to be working and looking at various options as it deals with addressing the needs of this community.
Well, the state of California is going to allocate about $75 million. That's what it costed to the state of California. Would Connecticut would allocate some money as well, not just for the people that is seeking medical treatment, but for people to pay rent? You know, they need some kind of relief at this point.
Well, as you know, we have a rent relief program that's available for everybody, and that is a grace period in terms of having to pay that rent. So anything for COVID-related costs. So I hope people are covered there and feel some sense of confidence.
Well, thank you, Governor.
We'll move along next to the Associated Press.
Good afternoon, Governor. Today, the president was tweeting multiple times about how the states have to step up their testing. And Governor Cuomo was talking about how the states, this is going to create more competition between the states for testing materials, sort of like what happened with PPE. And Governor Cuomo also said that the states can't do it alone, they need federal help. What is your reaction to that? Are we able to do it alone, or do we need federal help as well?
Man, I could help Connecticut navigate through this COVID crisis or respond to every one of the president's tweets. The federal government should help when it comes to what we need in terms of swabs, the reagents, the kits. They are the best ones able to do that. In the meantime, we're doing everything we can at the local level. And we'll pick up where they leave off. And working with our amazing hospital system, we're sourcing all the testing gear we need. We need FDA approval for some of the antibody testing, but I'm not going to put all the burden on their shoulders. We're going to do everything we can as a state to roll out the testing in a more aggressive way. I can't wait for the feds any longer.
And regarding the antibody testing, you were talking about Stanford, how they were going to start the first testing. Are they going to be the first ones in the state to do antibody testing? And I just wanted to clarify, like the CVS, that's more like whether or not you have it or not.
Exactly. That's the PCR testing. I believe we have antibody testing, Josh, in a variety of our different hospitals.
Quite a number of our hospitals are performing antibody testing right now.
Okay, thank you.
News 8.
Governor, you opened up in the last 24 hours, maybe this question is for Josh, the COVID-only facility in Sharon for nursing homes. We had workers call our station and talk to us about not having just basic N95 masks for the CNAs. Have you heard anything about that? Where do you stand on PPE? And I know you do check in every day with the nursing homes around the state, but what are you hearing back, and is this, they're COVID only?
Yeah, you know, I've actually heard the exact opposite of that. I talked to Barbara Cass earlier today, who you met at the press conference last week, who heads up our licensing division at the Department of Public Health. She was physically up there yesterday inspecting the site herself, said the site was incredibly well set up, well stocked with PPE, and the staff was in place and ready to go. So I'm not sure where that comment came from.
And within the own contracting for our COVID-only facilities, it has to ensure that PPE is provided for those facilities.
Well, that's good. Good to know. I'm glad you answered the question. Absolutely. Then where do you stand on the other three? You said over the weekend they're going to be opening up because there is a demand, and it sounds like it's rolling forward pretty quickly here.
Yeah, so the others that are coming online in the next couple of days, Northbridge in Bridgeport is going to be bringing online 146 beds. They are potentially accepting patients as soon as this evening. Torrington, which is one of the sites that had been decommissioned we've reopened with the support of the Connecticut National Guard and others, is planning to come online on Monday with another 126 beds. They just have to finish up the kitchen facility there, and that's almost done. There's another facility in Meriden, Westfield, which will be bringing admissions in early to mid next week, another 120 beds, and there's several more in the pipeline, so this is moving quickly.
Thank you very much for answering the question. I appreciate it.
You're welcome.
Thank you.
Move along next to the current.
Governor, I just wanted to be clear on the schools reopening. Are you considering in any way that the schools could possibly reopen on a regional basis, meaning that Eastern Connecticut schools could reopen before Fairfield County, for example?
Yeah, I'm going to wait for the information from the Reopen Connecticut group. We're going to get more information from them. But look, from my point of view, Chris, bars, restaurants, stores that attract people across the state are probably things we want to open or close on a statewide basis. Schools, I have more of an open mind on since they're more local by definition.
Okay, and also one question. Governor Cuomo had issued an executive order requiring the nursing homes to tell the family members about COVID positive cases and deaths within 24 hours. Are you considering a possible similar executive order on that point?
I thought they did that. They don't do that now? I'll take a look at that, Chris.
Sometimes we get feedback that they're supposed to do that, I guess, but a lot of times we get feedback that they don't do it.
I'm going to have to report back to you on that, but they should do it.
Okay.
Move along next to CT News Junkie.
This is for the governor. Governor, why would you decide to put your Reopen Connecticut task force inside Advance Connecticut, which is not subject to FOI? So how transparent is this process going to be?
Well, as you know, Indra Nui helps oversee that. She's co-chairman of it, so I thought that was a place where she already had a perch, and it makes a certain amount of sense. That's a group that has a lot of liaison, obviously, with the business community, so we were thinking about how we work with small as well as large businesses, have them at the table, along with labor and along with the scientific community. So it seemed like an appropriate place to launch this. It's purely advisory, by the way. That's why we need them. But they have good feelers out to their respective communities, and I really think of them as a group that's going to be able to give us the very best information going forward.
And what role has the legislature played over the past week in some of your decision making?
Well, I'll start with that, and then Paul is in daily contact with people. Look, legislators are going to be involved in the committee. They got a full briefing yesterday, I think, for an hour and a half. I've had personal conversations with most of the leadership, in particular Len Fasano, who put together a very thoughtful reopen plan probably a few days ago now that was immediately shared with our advisory board.
And as the governor stated, I think I spend most of my time speaking to members of the legislature, from leadership to rank and file. Earlier this week, the governor and I participated in a 2-hour meeting with the Black and Puerto Rican Caucus. On Monday, I will be meeting with the chairs from the House of Representatives, of chairs of all of the various committees. The legislature is an integral part of any of the processes that we're going forward, not only last week, but the weeks before that. We understand that this is a partnership, and understand that under the emergency powers that has been granted through the legislative body, that it's a powers that we don't take lightly. And so my team and this administration, including all of our commissioners, will continue to be in close contact with the legislature, and will continuously provide information not only to the legislature but to the general public. This is one Connecticut, as the governor always says, and so we all have to work together.
Move on to Hearst, Connecticut Media. Hearst, Connecticut Media. One more time. Ken Dixon, Hearst, Connecticut Media.
All right, I think you'll get that final slide up there. I just wanted to, again, thank Vanessa and Miriam. What you're doing, the stress that people are feeling, when it builds up, talk it out. Talkitout.org. Go to Talk It Out. We've got people who want to reach out to you and talk to you. I wanted to end on this slide because it makes me smile. With all the stress that's out there right now, believe me, I love all 169 towns. I'm not a fool. But this is Willimantic. Willimantic is one of my favorite towns because of the sense of humor they have. And, you know, most places they have pompous generals on horseback as you, in their statue as you go over a bridge. They have their frogs. And Willimantic is a place that thankfully so far has a relatively low infection rate, but they're taking social distancing seriously with a little sense of humor, and you see the frogs appropriately wearing their mask. Here's to you, Willimantic. Thanks, everybody.